Krista Wortman, and I'm here today with Nicole Smith of Sleep Consulting. Welcome, Nicole.
Thank you. So happy to be here.
Good. Yeah, so glad to be talking about this. Sleep in kids and adults is such a hot button issue, I feel, right now. And I know you've been doing it for a long time with infants all the way up to early elementary. So
Correct. Yep.
Can you tell me how you got into this?
Yeah, so I actually had a baby, our first one, who didn't sleep well. And so I was able to find a program that we put together. We got him sleeping really well. And then after that point, we're like, man, we could have some more kids, right? So we did, and I was able to really get them sleeping well from the start too. And so that was really important to me, and an opportunity came up through the same program I used to become a consultant, to get certified, and then to own my own business. So it's kind of how I got started a few years ago, and it's taken off from there. And like you said, it's such a big issue. Kids, adults, we all need enough sleep to really be the best versions of ourselves. So
that's the truth.
Yeah.
That's the truth. I know I see certain things like I see narrow airways in patients, and enlarged tonsils and adenoids and oral issues that I can see that would impinge on their sleep and cause them a bad night of sleep, poor night's sleep. How are you treating sleep?
Sure. So I obviously not a medical doctor. So what I deal with is mainly kids who have behavioral or habitual sleep disturbances. Okay. So the most important piece for a child when you're trying to get them to sleep well is that they learn how to fall asleep on their own. And the reason for that is that when they wake up in the middle of the night, just like you or I do, right? We turn over, we get comfortable, and we go back to sleep. But a lot of times kids develop what I call sleep props. So for a baby, a lot of times it's being fed or rocked to sleep, and then you lay them in their bed already asleep. Okay. For a toddler or an older child, a lot of times that looks like mom or dad laying with them in bed until they fall asleep. Now, if they fall asleep with these sleep props, the issue is that when they wake up, they can't go back to sleep on their own, and they need that parent to do it for them.
Interesting.
Yeah. So that's the way that we really work to kind of help them learn to sleep independently, learn to sleep all night, and then obviously for babies or toddlers who are still taking naps, to take good naps during the day too.
And how long does this whole process take from the time someone calls you to start a program to they start to see some results?
Just a couple weeks.
Oh my gosh.
Yes, which is crazy, right? You would think it would take longer. Babies, usually about 2 weeks it takes till they're sleeping through the night every night and getting into a really consistent nap routine. For toddlers and older kids, it's usually a few more weeks. There's usually some behavioral issues at home that they're pushing boundaries, and we need to kind of reset that so that they kind of see mom and dad as, the person in control. Okay.
Yeah, probably the earlier the better, right? Because the older they get,
yes,
the more ingrained
and the more habits they have and everything. Yeah.
Wow.
So.
Hi, my name is Emily, and we just finished working with Nicole Smith. Our son Ezra was not sleeping at all. I mean, he was waking up easily 5 or 7 times a night, and sometimes he would just wake up for 3 hours at a time. And this was consistently over 4 months. So my husband and I were just delirious. We didn't know what to do. And so we contacted Nicole, and she put together a plan. And now Ezra falls asleep on his own, and he sleeps through the night and doesn't wake up.
Myself and my family cannot say enough good things about Nicole Smith and working with her. Our son was about 6.5 months old, and we had worked on a different sleep program where you're just on your own. So that did not work out for us. We really needed one-on-one consultation, and I found her just through a Google search, and we followed everything, and he is really a great sleeper now. I can't complain, and it really just seriously changed our lives. We were so tired. We never made time for ourselves. I was always having to hold him for his naps, which was fine, but I could not get anything done. It was just so great to be able to put him down in his crib and know that he was going to sleep good. And
that's so exciting. That's really great.
It is.
I know with lack of sleep, can you talk about some of the things that you would see in kids' behavior issues and poor nights of sleep?
So poor nights of sleep actually, and I think you would talk about this too with the airway and things, but poor sleep can actually cause us to gain weight. Okay, it actually stimulates a hormone in the body that increases our appetites. And so poor sleep, whether it's child or adult, can actually increase that appetite and cause them to gain weight. It's a, risk factor towards obesity in childhood, and I know obesity then also causes sleep disturbances too, right?
It's like
with
a
the
vicious
airway.
cycle.
Yes.
That's
Yep.
crazy.
So
Yes.
that's one way. But good sleep really helps promote good concentration and good productivity and also memory retention. So when you think about memory retention, think about like little kids, even babies, toddlers, you get into elementary school, right? And they're learning a ton every day. Babies are exposed to so many things. They're learning constantly. But the cool thing about memory retention is it actually happens during deep stages of sleep. So your brain is storing things that you've learned throughout the day. But if you don't get enough deep sleep, it doesn't happen as efficiently as it would if you were sleeping well. So that's a major benefit for kids, right, with sleeping well. But then also just other, health things. For kids, it helps build a strong immune system. It helps them just like be happier in general, right? Like they have a happier disposition, but it also helps with the production of growth hormones, right? Like we want our kids to grow well, and things like that. For adults, better sleep is actually linked to lower risk for things like type 2 diabetes. We talked about obesity,
So
right?
true.
But also heart disease and high blood pressure and lots of other ailments that, our people are plagued with can actually be helped by a good night's rest.
Definitely. Like on our end here, like I was telling you, like Mark and I are getting into treating patients, with sleep-related breathing disorders. Doing like an airway screening with a piece of equipment that we have, and doing a home sleep study where we can see is it snoring or is it actual sleep apnea,
Right.
Which is so important. And unfortunately, that it's gotten to that age. But a lot of times, like it could still be an adult has a small jaw and their airway's constricted because of all that. Then the tongue has to fall further back, and there's really nothing you can do with that. You're not going to go through jaw surgery in our adult years to treat something like that. So if you can catch these things early on, like you were saying, and like I know from a dental perspective, I screen patients for like a narrow jaw. Like if a patient has like a narrow jaw, the roof of their mouth is really high and it impinges on their nasal cavity. So I do it like a palatal expander where, they gently turn the expander each day and it widens the upper jaw. So then there's room for the lower jaw to come forward and the tongue comes forward. And then also that floor, the nasal floor drops with the upper jaw, and you all of a sudden have more room in your nose to breathe because nose breathing is so important, nitric oxide, things like that. So that's one thing, just by helping patients to get a better airway, by widening their jaw. And then like if you still see like large tonsils or adenoids, that's something that would have to be looked at by an ear, nose, and throat doctor.
Yeah.
Just all those things to help clear, and the behavior issues to help them have a
Exactly. So
better
one
night's
thing that I
sleep.
do ask the families that come to me initially is, does your child snore? Do they have a history of it? And if they do, I like to dive a little bit deeper into what it is so I can find out, is this truly behavioral or is this a medical issue that we need to get fixed? And then if it's medical, then I farm them out to,
That would be hard
medical
to say, like,
professional.
do you say, like, have they, had a screening of their airway or at the
Yeah.
doctors or the medical office?
Yeah, I think when we talk about, what's currently going on, right? It's important for me to diagnose what the problem is. Is the problem that they're depending on a sleep prop? If it is, that means I can fix it, okay? If they have a sleep prop and then afterwards we're still finding maybe a little bit of an issue with sleep, and maybe it's that they're snoring or that they're still waking up for long periods during the night, it might tell me there's something medically going on. Maybe they have that sleep apnea. Maybe there's something going on with the oral cavity. At that point, I would say we need to maybe go to the pediatrician first, see if they have any ideas. Sometimes there's low iron or low magnesium too,
Oh, wow.
and that can cause sleep issues as well. So we have a blood test run, make sure there's nothing there, and then if there's nothing there, then we move on to the next step. So
It's a very thorough program.
It
That's
is,
great.
yeah.
How many clients do you think you've seen and helped then?
yeah,
Since you
so
started?
at the end of last year, I arrived at like my 50th.
Oh my
so,
gosh.
Yeah.
That's so rewarding.
Yeah. So I'm tracking this year to have about 5 a month. So I should
Nice.
hit 100 within the next, few months, which will be really exciting, be a big milestone for me.
Nice.
Yeah.
Congratulations. That's awesome.
Thanks.
Now, where can future clients find you?
Sure. So I have a website. It's NicoleSmithSleep.com. And then my email, NicoleSmith or Nicole@NicolesmithSleep.com would be my email. But everything's on the website.
Okay.
You can set up a free 15-minute, it's just like a ask me anything kind of call.
Oh, that's
Where we
nice.
really talk about like what the problems are that you're experiencing, what your goals are for your child's sleep, and then I let you know how I can help. So sometimes there's little bitty tweaks like, oh, maybe you just need to wait a little longer before their first nap. That will help fix things. Or it's much more comprehensive, and we do need to have a working relationship in order to fix the problem. So those are totally free. It's just like,
so
let's get
nice.
to know each other,
Yeah.
see if we'd be a good fit to work together.
Yeah, just to get your name out like that, and just like, especially for new parents, I'll never forget like that first month and a half of just like having a newborn.
Yeah.
You're walking. The parents are walking zombies, so
Yes.
they're not getting a good night's sleep,
Yeah.
and then the child's not getting good
Yeah.
habits.
And
So.
the newborn stage is actually
Oh my
my
gosh.
favorite to work with. It's pretty much when I taught all of my children to sleep well. It's a lot different than any other age as far as learning to sleep goes, because babies are sleeping, or they're sleeping a lot, but they're eating a lot too, right? Every couple hours. So we work on, again, learning to fall asleep on their own. As they learn to do that, then they start to naturally just stretch the amount of time that they
Wow.
sleep. Usually by about 12 weeks, the families I'm working with have their babies sleeping 11 to 12 hours straight through the night.
Oh my gosh.
And they're still growing, eating fine. It's
gosh.
incredible. Like,
That's great.
You think about that, that's got to be impossible. There's no way.
Yeah.
It happened for all of my kids, but it's happened for probably half of my clients are in the
Wow.
newborn stage.
Wow.
And it's really rewarding, right, to have
Yes.
that, because
Yes.
you remember being a
Yeah.
new parent,
Yeah.
it's so hard just to learn all the other things
Yeah.
about being a parent.
And then it
But
affects
when you're
just
not
your daily
sleeping,
life. Yeah. Like
So-
you're not as engaged, to be as alert for your newborn, and
Right.
just filters into so many things.
Yeah.
So that's awesome.
Yeah.
Great. Well, so you can find Nicole on her Instagram and Facebook page. And then also Summit Family Dental has an Instagram and Facebook page you can look us up on. And like I said, at Summit Family Dental, we can screen for your airway and the jaw size. We're looking forward to seeing you.